what's up everybody? Today we're going to be going through a video with some simple exercises that you can do at home if you've been suffering from sciatic nerve pain. So that's that naggy pain, maybe running from your back, anywhere down behind the leg, and possibly into the foot.
And good morning everybody, my name is Craig.
And I'm Brittany.
And we're going to show you some of these sciatic nerve moves and glides and all kinds of exercises that you can do to treat yourself. But before you go through this video, take the time to visit our YouTube channel at Integrated Physical Therapy and click that bell to make sure that you receive these notices when we release new videos.
Alright, so I have Craig here on the table and we're going to say that his right side is his affected side. So maybe he's been having pain that runs, like I said, from the back, anywhere down through the butt, back of the leg, and it can go down into the foot as well. Doesn't have to be from top to bottom. Sometimes you're just going to feel symptoms down in the lower part of the leg, sometimes just in the butt. But whatever it is, if you've either been diagnosed with sciatica or you're thinking that you're having that sciatic related pain, then you're going to go ahead and try these exercises out. So first we're going to do something called Lumbar Rock. So I have Craig on his back. He's going to do a little bit of a pelvic tilt first if you want to try that, just to make sure that there's not a big arch in his low back and the low back is touching the table. Then once he gets that nice and stable, he's going to rock the knees from side to side within his pain-free range. And you're going to do one set, maybe 15 to 20 reps, nice and gentle. He's keeping his hands on the table. He's not forcing his body into a full spinal twist. If you have less range of motion, you're just going to meet your body where it's at.
We always want to be in a pain-free, positive range of motion because we want to teach our body that it's safe to move within this range of motion that we're performing.
Yeah, and the no pain, no gain principle doesn't really apply in physical therapy. When you're talking about rehab, you want to, excuse me. When we're talking about rehab, you want to avoid pain. So going into pain is just repeating what your body's already doing. Now we're going to try and work our way out of it.
And speaking of repetition, we like to do high repetitions with no pain, pain-free range of motion, because it teaches our body that we're able to move safely within this range of motion. And that'll slightly increase as we improve our range of motion and as we do more repetitions.
Okay, so after you finish about your 15 to 20 of that, what is going on with my frog in my throat today? Okay, after you finish your 15 to 20 reps, then you're going to take it into a Piriformis Stretch. So I'm going to have Craig cross his right foot over his left knee. Perfect. And for some of you, that's going to be enough of a stretch. What we're looking to feel is something in that outside kind of back pocket area on the outside of the right hip for now. Okay. From this position, Craig, are you able to grab behind the left thigh and hug in towards your chest? Perfect. And where do you feel that stretch?
Right in my tush.
Okay. Exactly where you want to feel it. So that piriformis muscle runs right over the sciatic nerve. And sometimes when you're pushing and getting that stretch, it's going to compress on the nerve, which can cause you to feel a little bit more of the symptoms during the stretch. Rule of thumb is that when you come out of that 30-second stretch, you should have 10 to 15 seconds of symptoms max. And then you should go back to your baseline. If it's longer than that, you want to modify the stretch a little bit. You can keep the foot on the table, or you can even try bringing the knee across towards the opposite shoulder, and that's a little bit less intense and you have a little more control there.
I can also angle using my left hand on my foot and ankle. I can change the angle of my rotation to get it exactly where I need to be.
Okay, and then we're going to try nice and slow coming in and out of the stretch, so we're never moving in an abrupt fashion. Go ahead and try the same thing on the other side. You don't have to do both sides when you're doing this at home. You can just do your affected side, but chances are that you probably can benefit from getting a little bit on both sides.
And it's funny, I find that my left side is more restricted than my right side. So I do like doing both sides because even though I might have symptoms on one side, it's always beneficial to make sure that I have mobility throughout my whole system.
And sometimes the affected side isn't the problem side. It can go back and forth. Right. So we want to make sure that we have as much mobility, flexibility, stability as we can throughout the body. And nice and slow, go ahead and unwind out of that. Perfect. And let's say that Craig was having a little bit more symptoms. Like I said, he was compressing on that nerve. He's feeling it there. We would wait that 10 to 15 seconds just to make sure that everything subsides, goes back to baseline. It's okay if you irritated a little bit and maybe you overdid the stretch. It's not like there's no going back. That just means that the next time you go through your stretches, you're going to modify and go down a little bit for the next round.
Brittany made a great point. No pain, no gain has no place in rehabilitation. You do not need to or should you work through pain.
Exactly. Next thing we're going to do is specific for that sciatic nerve. It's called nerve glides. And if you picture that length of the nerve coming from the back all the way down through the back of the leg and into the foot, we're gonna move through the entire length of the nerve. So go ahead and grab behind your thigh there. And you can hold it as close or as far as you feel comfortable. If you need to use a strap, maybe you can't even get to the leg, that's okay too. You can put a strap behind the thigh and hold that there. Then from here, you're gonna work on straightening the leg, getting it as straight as you can, and then you're gonna pull the toes towards your nose, point the toes, and then bend the knee. So in the position when Craig pulls his foot all the way up and then toes towards the nose, that's where you're gonna put the most tension on that sciatic nerve. So that's where you're gonna feel the biggest pull. Typically gonna feel it more concentrated closer to the foot, but you're getting through that whole length of the nerve. And are you feeling any pulling when you get there?
Very much so. Feeling a nice big pull behind my calf, down into my hamstring. And thankfully for video purposes, we're showing you these exercises, and I don't have any sciatic discomfort at this time, but I have had it in the past, and this is the one thing that has really helped me get out of it.
And I use different kinds of sciatic nerves for warm-ups during a workout. It really helps with hamstring flexibility and things like that. So if even just that is something that you struggle with, mobilizing the sciatic nerve can help with flexibility and mobility throughout the back of the leg. You're gonna go for 10 repetitions of these. And the biggest key with nerve glides is the frequency in which you do them. So every 1 to 2 hours, you're gonna wanna do this either in a laying down position like we're showing you here, or you can do the same movement sitting down in the chair. But you wanna get frequent repetitions throughout the day so that you can really work on that nerve mobility. Normally, a nerve should move through your body, kind of like a shirt sleeve moves on your skin, so nice and easy. When it gets restricted, whether it's at the back, the piriformis, anywhere down the leg, it's gonna be a little bit more like this. And that's what causes those symptoms to radiate down through the leg.
Now, I've only been doing this for a few minutes here, but I'm already noticing a nice release and opening in the hamstring, in the calf, and even the nerve itself is starting to move a little bit easier throughout the leg, and I've only been spending a few minutes here. I'd also like to point out that one of the reasons why it's much more tight on this side is because of my bulging biceps.
That's what I meant to say.
Right.
So after your 10 repetitions, let's try the same thing on the other side. And you might notice that one side is tighter than the other. That's okay, just meet your body where it's at. Same rule here applies with those symptoms down the leg. If you feel it a little bit more intense during, that's okay. Shouldn't linger more than 10 to 15 seconds after you finish. And some ways that you can modify are taking out that extra toe toward the nose movement. So if he was really, really tight or really affected in the sciatic nerve, you could work through just straightening here and maybe just a gentle little movement towards the nose instead of pulling the toes all the way back towards him. And let's talk a little bit about the two words centralization and peripheralization of symptoms, which are just really fancy big words for moving towards the source of the problem and moving away from the problem. So when you're really, really irritated in that sciatic nerve, that's when you're gonna have symptoms that are radiating further away from the source, further away from the back, and maybe into the foot. As it starts to heal and feel better, what you might find is you're getting less frequent or less intense symptoms far away from the body, and that it's actually moving down towards the butt, towards the back. So if it's coming out of the calf, but maybe getting a little bit more intense in the butt, that's actually a good sign, and don't be scared if it's getting more intense closer to the source of the problem.
That's a great explanation.
And last thing here, we're gonna do some extension. So I'm gonna have Craig flip over onto his belly. There's a lot of different ways you can do this. You can do it in standing, you can do it against the table. The one we're showing you here is just one of many different ways to do it. An extension is the movement of kind of like a back bend. So typically, especially with a disc-related issue, we wanna try and work in this direction of movement, that opposite C curve through the back. And Craig's up on his elbows here. How's that position feel, okay?
Feels pretty good.
And exactly, if he can go a little bit further, then he's gonna push through the hands, and he's still gonna try and drive those hips down towards the table so that the curve is coming through the back right here. If that's too intense, then you modify, you go down to the elbows, and you can bring the arms even further in front if you need to modify more than that. Sometimes even just the position of laying flat on the table is where you start. And even sometimes I've had patients put a pillow underneath their belly and start from that little curved flexion position, because already that's a movement that's hard for them. So we're looking for something that's tolerable to maintain for at least 10 seconds, and then we're gonna do 10 of those repetitions.
It's also important to make sure that if we're up for 10 seconds, that we're definitely down for 10 seconds.
And coming all the way down.
All the way down, that's correct. So it's a 1-to-1 ratio.
And same thing might apply here. Maybe the first you're feeling a little stuck, and then as you move through it, you're a little bit more fluid. always meeting the body where it's at, starting in that pain-free range, and then seeing as it loosens up if you're able to get a little bit further with each repetition. If you're doing it in standing, you can use the table, you can use the wall, anything to kind of support your body on. You always want to make sure that you're testing the position first, so you're not going into a crazy big back bend. Like this would not be the first position that you try. You always try the smaller movement. Wait until you're in that 10-second rest to kind of assess, see where your body's at, and then you can always try to go up a level. And you're going to be doing these pretty frequently throughout the day too, so that's why I talk about the standing position of it. Standing, you just kind of support your low back and put your hands here, and then you're going to push the hips forward and just meet the body where it's at again. I'm kind of doing a nice repetition here, holding that position, and then coming right back out of it and doing the same 10 seconds, 10 seconds. You want to do those frequently throughout the day, maybe every 1 to 2 hours, especially if you have a job or a lifestyle that involves a lot of sitting, because that's going to put you in the opposite position. So you want to counteract that flexion that we tend to be in all day with some extension movement.
Now the exercises that we're showing you today are perfect for sciatica or some low back discomfort. However, remember, you should always get an evaluation from a physical therapist or from a professional to make sure that the exercise prescription that you are receiving is good for what you need.
And this is the very bare minimum basics of what you need to get started. There's a lot more that we're going to incorporate in follow-up videos on how to progress and what you can do to make sure that the sciatic pain doesn't come back again with more stability and control throughout that low back and